and as our partnership grows, we're really excited. So Miriam, if you want to go ahead and go to the next slide, I can work through the agenda. Great. So right as in my introduction, you are all very familiar with me, but we also have Dan Peterson on the call with Alignment, and he's going to be doing a little bit of an overview of the company. We have Jeff Chicotts on. He's going to be talking more about the patient benefit and sales in that area there. So excited to hear from him. We also have Dr. Michael Kadansky. He's going to be talking about the clinical model and how you can connect with Alignment for your members. And then Miriam's going to be talking, Miriam Molina is going to be talking about the operation side and how you are able to be ready to see those members as they come in. So I will go ahead and hand it over to Dan. Again, thank you so much for joining us and looking forward to hearing more about Alignment.
All right, thank you, Johnny, and thank you to all the ACN partners who made time today. I know everyone's so busy, so we appreciate the chance to be together on this Zoom call. My name is Dan Peterson. I'm the relatively new market president for Alignment Health Plan of Arizona. Super excited to be partnered with ACN in Maricopa and Pima counties. We've gotten to know Todd and Johnny and Mark and the team, and we're just thrilled to have a partnership with such a prominent network throughout the state. And we're really excited about not only this year, but so many future years coming up in the next few years. This first slide is just going to help me talk a little bit about Alignment Health Plan, so you understand some of our basics and where we've come from. We're a 7-year-old Medicare Advantage health plan. We acquired a small health plan in California back in 2014 and have done just really great with our operation in California. We have significant growth year over year, high star performance, high quality scores, great member retention, a lot of awards won. This slide here talks about a couple of the awards. If you look up in the upper right, you'll see that we're one of the 5 best plans in California. And that's quite an accomplishment because there are approximately 55 plans in California. So we're in the top 10% of performing plans. The lower right shows a quality award we won for our pharmacy efforts. We're a 5-star plan when it comes to the Part D pharmacy coordination, and we're a 4-star plan out of California on the overall metrics. Of course, we're new to Arizona, so we won't know our star score for a few more months, but we're looking forward to doing just as well in Arizona, especially with so many quality partners like the ACN network. You'll hear from Jeff in a little bit about our value proposition. We won our Health Metrics Award recently. So this is a third-party entity that stacks all the Medicare plans up side by side and measures the value to members that choose Alignment over our competition. And we win this award a lot in a lot of our states. And by the way, we've expanded out of California. Now we're in Nevada, North Carolina, and Arizona. So we're really excited about our growth and our expansion. The lower left speaks to the fact that we had a public offering in March. So we're very strongly capitalized now. We went to the market to raise capital, to be in a position of financial strength and to allow us to come into states like Arizona with a lot of stability. Next slide, please, Miriam. I talked on some of these points, but just to reiterate, we typically do very well with our CMS star ratings. You see in the upper left our historical rating coming out of California. There's another ranking if you go to CMS Medicare and You. We have a 90% ranking from Medicare beneficiaries, very, very strong score. The center circle there shows a heart in it. We've been talking about an all-company meeting we had a couple weeks ago, and our CEO led off by saying we needed to have a servant heart when we're taking care of our members and working on our provider partnerships. And I know it sounds cliche, you hear a lot of healthcare companies speak in those terms, but we are really trying to make that true to what we do. And I think you'll see a difference in how we approach our relationships with you, our provider partners, but also with our members. We're now a $1 billion company in terms of our gross revenue. And then you see our market capitalization rate due to our recent public offering. The upper right shows our employee count. We're now over 800 employees in the 4 states. Very proud that our company is investing in a lot of us Arizonans. We have, I think, 12 or 13 now boots on the ground in both Phoenix and Tucson. I'm a Moon Valley Rocket alumni. I don't know if we have any Rockets on the call, but proud that I grew up in Phoenix and spent a lot of time in Tucson as well. So really pleased that we have a lot of Arizonans working on our success here in our beloved state. Lower left, you'll see our net promoter score, and we are double the industry average. So this is talking about members referring alignment health plans. So we get referred a lot to members, relatives, and friends, and that really helps our growth. The next circle shows 85,000 members in our multiple states. We have a 36% cumulative annual growth rate. So we are doing very, very well. We have market leading benefits. You'll see those in a second. Oh, I just saw a Greenway Demon note there. That's all good. We'll work with Greenway Demons too. We have 42 products in many different markets. Jeff's going to talk about our different products here in Arizona. And then Dr. Kanansky is going to speak to our clinical model. You see one of our key clinical metrics. We do a very good job at keeping our members, your patients, healthy and at home to the extent possible. A lot of you have heard that it's 10% of the Medicare beneficiaries that create 90% of the costs. And we're very good at partnering with you to focus on the sickest of the sick, to keep them healthy to the extent possible. Before I turn the floor over to Jeff, I just wanted to share a conversation we had with our leading broker in Arizona. We rely heavily on independent brokers throughout the state. The lady that's selling the most alignment moved to Arizona not too long ago. So she sold alignment in California. And we asked her what the secrets to success are. And she gave us 2 succinct points. One, alignment is consistent year over year. People often wonder when new plans come into states, are they going to buy the business with very aggressive benefits and then go away next year or the year after? We have no designs of doing that. We've shown a track record of making our benefits consistent year over year. And the reason we do that is we generate really good clinical outcomes. You're going to hear from Dr. Kadansky. The second point is this leading broker said she has very few member issues. We take care of our members. We deliver exceptional service. We have great scores. You're not going to have a lot of headaches dealing with alignment. And by the way, one other point I wanted to make, Dr. Kadansky and a lot of others on our team have spent a lot of time on the provider side. About half of my career has been working in medical management on the provider side. And I know it's important to have an effective health plan relationship. You'll have all of our cell numbers. We're a phone call, a short drive away, the troubleshooting and making this really work for you and your patients. I'm really excited to be partnered with you and with ACN. And it's an honor to be in this relationship, and I look forward to meeting a lot of you eventually. And now I'm going to turn the floor over to my colleague, Jeff Chikotz, who's our regional director of sales.
Thank you, Dan. It's really great to see all the Arizona Care Network team on this afternoon. Thank you for taking the time. As Dan mentioned earlier, we're really happy to have this relationship and partnership with you. One of the key visions and goals that we have in our organization is keeping our member in the middle. Dr. Kadansky will talk about our model of care that really helps us do that from a care perspective. Before I talk about market benefits and highlights, every single member that becomes a member of Alignment receives our Access on Demand concierge card. It's a 24/7 access to the health plan. It's a one of a kind in the marketplace. It's one card. Every member receives it. And what this does, it helps them navigate services and benefits 24 hours a day, 7 days a week. They can even speak to a board certified doctor anytime, day or night. And it helps with, deciding, next, questions about their care. But the card also acts as a debit card. And so our benefit design, like around over-the-counter grocery and wellness rewards, gets loaded onto this card automatically. There's nothing that the member needs to do. This is a one-of-a-kind card. A lot of our competitors have tried to copy what we've done, and they issue multiple cards. But you can see from an on-demand concierge, it really is VIP treatment. You can see that they can arrange transportation, gym access, pet services. Yes, some of our plans have pet services, dental, personal emergency response, virtual care, vision, pest control. Yes, it's a supplemental benefit on some of our plans as well. Even companion care. I'll talk at very high level about those in just a moment. But you can see on the bottom side of the screen that our over-the-counter benefit, our grocery benefit, the wellness rewards are automatically loaded into this card every single month. So it really is, when Dan is talking about high-level service, this is one of the ways we do it, keeping our members in contact and speaking with us about any concerns they might have about their care or receiving any of the benefits. The next slide talks a little bit about our pharmacy plans. Dan mentioned that we have a 5-star pharmacy plan. And there we go. We don't have standard or preferred pharmacies. All of our pharmacies are preferred. You can see them listed there. Walgreens and Costco are our mail order pharmacies. But we also have independent pharmacies that a member or a broker or a caregiver even could go onto our website, alignmenthealthplan.com, find a drug or find a pharmacy. Will help them as well. So we're really happy that it's very simple. One of the things we try to keep in mind is make it easy and simple for our members. So to get the 5-star pharmacy rating, it's a testament to the work that the health plan has done. I'll start talking a little bit about benefits. Let me just say this. On the next slide, we'll talk about the HMO plan first. For those of you who have followed benefits in the Arizona market for any length of time, you haven't seen benefits like these in quite a bit. And a lot, as Dan said, we get a lot of questions about how we can offer these kind of benefits. Well, Mike Kadansky is going to talk about our model of care and our ability to drive costs lower than Medicare. And that helps us drive back benefits to our members. Needed benefits, by the way. Zero premium. And by the way, we've co-branded our HMO in Maricopa and Pima County, El Unico, for our Hispanic population that we market to. So zero premium on both plans, maximum out of pocket, $2,499, which is the lowest offered in either one of those counties. Inpatient hospital, $100 per day, 1 through 3. Now, it is very typical to see inpatient hospital copays of $175, $185, $195 in our market for days 1 through 7. I think one of the things that, as you begin to understand the alignment strategy and our mission, is to make healthcare easier for our members to access. And this is one of the ways we do it. You can see PCP specialists, lab and x-ray, all at zero. Ambulance, of course, included. Embedded dental, actually on all of our plans. Hearing aid and over-the-counter. So, for instance, I mentioned the over-the-counter benefit on the access card, the black card, is $25 every month. It's not a rollover. So if they use, for instance, $23 of it in a month, the $2 will drop off and we automatically load another $25 every single month. Nothing that the member needs to do. These two plans are the ones that Dan mentioned earlier that we got recognized by Health Metrics as the only plans in Maricopa and Pima County to be awarded the cost share award. So we're extremely proud of these plans. They've gotten a lot of attention out on the marketplace, as you can imagine. The next plan is our chronic SNP plan. So we offer a full portfolio of plans in our marketplace, HMO, PPO, and this is our chronic heart and diabetes plan. You can see it has a zero premium as well, max out of pocket, $24.99. Inpatient hospital, zero. PCP, specialist lab and x-ray, zero. This has been, besides our HMO plan, this is our most popular plan right at the moment from an enrollment perspective. And if you do any research across the market about chronic SNP plans, you'll see that this is a market-leading benefit. You can see the dialysis service, embedded dental, vision, hearing, over-the-counter $40 every month on this plan. This even has included our personal emergency response. That's the device that would hang around a member's neck, and if they need any medical attention and they can't get to a phone, it's there for them as well. This is going to be an extremely it already is an extremely popular plan with our brokers and new members for January 1st. And we really expect this to continue on through the OEP and through lock-in for the rest of the year as well. Again, these are just high-level benefits. And our last one is our PPO in both Maricopa and Pima County. A zero premium, maximum out-of-pocket, $3,900 in, $6,500 combined out-of-network. Inpatient in-network, $150 a day, 1 through 3, 30% out-of-network. Again, extremely competitive, market leading from a PPO perspective. These are local PPOs. In other words, for the members that live in Maricopa and Pima, they're not designed to compete with the national plans that have that can tap into a national network because we're expanding. But this is an extremely popular plan as well, extremely competitive. One of the things I do want to share is that you can see the PCP and specialist visit in network is 5 and 20, lab 0, x-ray 15. But you'll see that it's called the new AVA PPO. AVA stands for Alignment Virtual Application. That is our model of care and our technology that Dr. Kadansky will talk about in just a moment. But for members, because the pandemic changed the way we members access healthcare, and telemedicine visits and virtual care was a thing of the future, is now a thing of the present. So if a member chooses to do a virtual PCP or specialist with this product, those copays will be zero for PCP and specialists. So this is a one of a kind plan introduced last year in our California markets, new this year in several of our new expansion markets, and a really great alternative for people who want to have a little more freedom of choice over an HMO plan. I mentioned the supplemental benefits. It depends on the plan. I can tell you, for instance, on our HMO plan, that is extremely popular right now, that pet care, pest control, the grocery benefit, companion care are all included on that plan. And we found that, and Dr. Kadansky will talk about, these benefits are all designed to improve our members' quality of life. Them by themselves don't deliver healthcare, but they help access to healthcare. And Dr. Kadansky has some great examples of why pet care and pest control. Of course, we offer acupuncture and chiropractic services. I mentioned over-the-counter on all of our plans. The grocery benefit, we found that our members were, running out of food and not having enough money to get them through the month. So the grocery benefits certainly contributes to their health and well-being. And those are included on our HMO benefit in both Maricopa and Pima County. And then dealing with loneliness and isolation. The companion care is designed to deliver non-medical services, light house chores, just general companionship to our members. And even before the pandemic, this is a big issue with your patients and our members. So we're really very pleased to be able to offer not only extremely solid core benefits on all of our plans, but the supplemental benefits just adds to the quality of life that we really expect that our seniors deserve. So I'm going to turn it over to Dr. Michael Kandansky to talk about our clinical programs.
Thank you, Jeff, and hello to everybody. I'm just going to take a few minutes to dive a little deeper into who we are clinically at Alignment, but I also want to make sure to save some time so you can all hear from Miriam and learn a little bit more about how we interact with all of you on the office level as well. I just wanted to reiterate, Jeff talked a lot about benefits, and I think there's the two pieces to benefits that are important. One is that by having the best benefits possible and the absolute lowest out-of-pocket costs and copays, it really eliminates barriers to care and makes sure patients get the care that they need. And I think for us, that's been our philosophy all along as to why we set things up the way we did. And from a clinical leadership perspective, and as physicians, we sit down with our teams to help design benefits and to really understand what our patients need and to draw from some of our past clinical experience to really eliminate those barriers and come up with more creative benefits that fill in some of the gaps in care that currently exists and that you've heard about already. The other thing I wanted to mention is that all of our clinical programs really drive excellent outcomes, particularly lower hospitalization rates, and that cost savings or reducing the cost of care is what eventually allows us to plow money back into benefits and why you see all these benefits that are in front of you. And talking a little bit about clinical programs themselves, I think some of the big pieces that we do clinically and that my team is involved in is care coordination. So really getting involved, especially when patients are hospitalized or something acute comes up, to where I'll be on the phone doing peer-to-peer calls with hospitalists and where our case managers are actively involved to coordinate care to get our patients safely back to you. So there's a lot of that's involved, as well as just all of you on the primary care side. You are the backbone of the clinical care that we provide and really responsible for the high quality care that our patients receive. That being said, it gets a little bit complicated, as Dan had mentioned, with that top 10% or the sickest members that often consume a lot of resources and are difficult to manage. And that's where we get a lot more involved. Our Care Anywhere program is exactly that. Basically, we start to target the patients that are at highest risk or have recently been hospitalized, and we offer in-home visits and services, as well as continued multidisciplinary support to get patients to where they're functioning at an optimal level, getting the care they need, and getting connected back to you. So you'll hear that tossed around quite a bit, the term Care Anywhere. And that includes a Healthy at Home program where almost all patients get at least an initial visit after hospitalization to make sure they're plugged back in. We certainly do a lot of other pieces to our model as well, but it also involves focusing on the patients that either are sicker, so the ones that have more advanced chronic kidney disease, either stage 4 or 5 or already on dialysis, that we will begin to follow. It involves a virtual care center piece, so especially if patients after hours have emergencies and need something to be addressed before they can see you the next day, we'll get involved and often try to fill in that gap. And then certainly, as I mentioned already, our case management program, which is very robust and often follows patients longitudinally or for basically as long as they need to be followed. There are multiple ways for patients to get into our programs. And if you want to go to the next slide, one of the main ways that we follow and manage patients is through our technology program, which we call AVA. And there's a couple of key pieces to AVA, including a very robust set of data that comes from multiple sources and is refreshed about every 15 minutes, but allows us to know meds that patients are taking and have filled, doctors or clinicians that they've seen, provides a timeline of all admissions and where patients have been over time, hospital, SNF, rehab, you name it, but really gives a full 360-degree view of what's going on with patients and provides us a lot of the data so we can stitch together and coordinate care in an optimal way. The other piece that we use from all that data is what we call our artificial intelligence engine, basically that allows us to produce a risk score and really identify or stratify out those top risk patients that need either a little more care or a little more support to get over that hump. And in addition to that, I mean, as clinicians and as physicians, you are always welcome to refer patients into our programs, but certainly we try to be very proactive in identifying the patients we think that have the highest needs, either because of their combination of chronic conditions, medications they're taking, previous hospitalizations, you name it, it allows us to act and be more proactive in that process. The platform also is useful for you though, because it really provides a really good and thorough view of what's happening with your patients. It also has real-time alerts that will give you an idea if they have open care gaps, either around HEDIS or quality, or even around capture or recapture of chronic conditions or HCC codes. So there's a lot going on in there. And as we get to January and you start to have members in our system and patients with us, I can get out to visit more directly and really show you what the system can do, because it's pretty impressive. It's more than I've ever seen before and gives you way more than just the typical data that you're used to receiving from health plans. The last piece I was going to mention is that, certainly we are here for you and local and able to get involved and intervene as you see fit. But our main goal is obviously to keep patients well and out of the hospital and getting them back to you. And when necessary, that's going to be part of our goal, is not only communicating with you as we see patients in the home setting, but picking up the phone and calling when there are either more urgent needs or things that you need to know about. So expect to hear from us as we go live and as our programs start to ramp up. I'm going to leave it at that for now, although certainly this won't be the last that we're talking, and I look forward to talking to you more as we launch and as we have more clinical shop that we can discuss together. For now, I'm going to hand off to Miriam and allow her to take over from here.
Thank you, Dr. Kanensky. Hi, everyone. I'm Miriam Molina. I'm the Director of Network Management. I also want to introduce you to Paola Ospina. She's part of my team. She's a provider engagement specialist, and we are both here to serve both markets, Maricopa and Pima. First, I want to talk to you about Access Express. Access Express is the system that we use for your staff to check eligibility, check claim status, do referrals, to check who's in network. And this is a tool that Paola and I have to give you access to, and that we also have to train you on. It's very easy to use, but please reach out to us. I'll share our contact information at the end of the presentation so that we could set up an in-office training or virtual. Okay. This is a copy of our member ID card, both PPO and HMO. It'll have the type of plan that the member is on, either AVA PPO or the one El Único HMO or Heart and Diabetes HMO. You will be able to see what PCP the patient is assigned to, and then the back of the card will have important information. This is another way for you to check eligibility. For this one, you don't have to come through my team to register. You can self-register starting January 1st. You just go to this website and you enter this information to be able to register, or you can call the phone number, but probably the easiest way and the fastest is to use the website. Okay. These are just the steps on how to get set up for the system. For claims, this is the address of where you would submit claims to, or if you want to submit electronic claims, here's the electronic submission ID. We do use Office Ally as a clearinghouse, and then there's important phone numbers on here as well. I did include helpful links here, so if you wanted to see who is in network, as far as providers, you could follow this and search by provider. The provider operations manual, this has a lot of helpful information, so I would recommend going through that. Authorizations guideline. This will tell you what doesn't need an authorization, what does need an authorization. Here is the link for our provider portal. This is the one where you can self-register for. And then here's the link for Access Express. So if you want to email myself and Paola, here's our contact information. We will send you a template where you can fill it out and let us know who from your office will need access to the system. You're not allowed to share logins, so everybody will need access as long as they're checking eligibility or doing referrals. Now I'm going to go ahead and open it up for questions.
There's one in the chat, Miriam.
Okay. Sorry, let me stop the video here. Hold on. Stop the share. Okay, will the card state if a referral is required? Not the card. It will not state that, but if you click on the authorization guidelines, typically the initial referral to a specialist does not require a referral as long as you're referring to somebody that's in network. But if you click on that authorization guidelines, it's very detailed and it'll tell you what specifically does need an authorization. Will we get a copy of the presentation? Yes, I believe Mark and Johnny will be sharing that.
Hi, Miriam, this is Johnny. Yes, the clinical performance consultants will be sharing a copy of the presentation. So if you want to reach out to them directly, but they'll also be sharing it with all their practices.
Thank you. Any other questions for us?
Check claim status, does it have to be through the portal that you have to give us access to, or is that on the same portal with the eligibility?
No, to be able to check claim status, it would be to the portal where we have to give you access to.
Okay, and you said we just send you an email?
Yes, send me an email and I can share the template that you just fill out for us to give you the access.
Thank you.
You're welcome. Anything else?
Hey, Miriam, I just wanted to add just a reminder to everybody, we're in the middle of Medicare's annual enrollment period. So this is our annual, it's called AEP. So this is a chance for Medicare beneficiaries to join Medicare plans. We always love referrals. So if you have anybody who's interested in learning more about alignment or hearing more about our wonderful benefits, just reach out to any of us. Probably Jeff would be the first one to connect with, but we'd love to grow your practice and grow our relationship with ACN.
Thank you, Dan. I see there's another question. Johnny, do you mind taking that one?
Yeah, I was actually just typing something in the chat for Esther. So you can reach out to your clinical performance consultant and they can help walk you through that process. I'm going to put the general inbox in the chat. So if you don't know who your clinical performance consultant is, you can send a message to our general inbox and someone will help get that information over to you.
Thank you. And I see there's another question from Ashley. When in the authorization website, are we able to enter the CPT codes and it will tell us if an auth is required? It will not flag you. However, if you do submit it, it will automatically approve. So it will not pend for anything because you don't need an authorization. You're welcome. Okay, well, thank you so much for joining today's call. If you have any further questions, please reach out to myself or Paola and we're here to help. You know, if you're interested in setting up a training as well, let us know. We're here for you. And everybody have a great day. Thank you for your time.
Thank you, everyone.
Thanks.
Thanks, everybody,
Thank
and
you.
nice to meet you.
Thank
Thank
you.